Suicide is a topic that carries a lot of emotion. It scares many of us into silence, and when we do talk about it, we often get things wrong. There are certain myths about suicide that prevent people in danger from either seeking or getting the help they need. How many of the following myths have you heard? People who attempt suicide are just attention seeking.
If somebody is using the extremity of a suicide attempt to seek attention, it's a very clear sign that they need some highly specialised attention and some help with solving the problems that they're experiencing and unable to solve in any other way.
A suicidal person clearly wants to die.
People who struggle with suicidal thoughts, there is often a debate going on in their head. They're not actually thinking about being dead, but they're thinking about bringing an end to an incredible level of pain and distress.
You should keep someone's suicidal thoughts or plans a secret if they ask you to.
If somebody talks to you about suicide or they're planning to take their own life, you don't keep that secret. What we encourage people to think about is that it's actually better to have an angry friend who's alive than a dead friend. Going to tell somebody who can do something about it and link you in with the support that you need is really important. And you keep going until you find the right person.
Suicidal feelings never go away.
For people who might be experiencing very strong suicidal thoughts for the first time, it can be absolutely terrifying. These things will pass. Having the right support at your fingertips and asking for help, and the person who's being asked being able to respond appropriately is critical.
You shouldn't talk about suicide with a suicidal person. It increases their risk.
For the person who's been struggling with those kinds of thoughts, the opportunity to talk to somebody about that who's going to listen to them non-judgmentally and help them is a relief. If you're asking somebody about that, it does show that you care, and often that person might have been waiting for the opportunity to talk to someone about it.
There's never any warning for suicide. They never ask for help.
Many people go to their doctors. Whilst they might not actually talk about suicide, they talk about a lot of other issues that are going on that could point to being very distressed and not coping. People who are thinking about suicide sometimes mask it very carefully. They try to hide that in a very confused state in their head that tells them that they're doing the best thing for other people. People could use behaviours to communicate the fact that they're not coping and that they're really distressed.
There's a typical kind of person who attempts suicide.
Whilst there's certain population groups that we know experience higher risk, there's no typical person that you can point to and say, that's a suicidal person. People who have a very chronic and serious mental illness are at increased risk of suicide, but we do know that the role of depression is the biggest risk factor, and depression can remain quite hidden.
Suicide happens all the time.
Thoughts about suicide are quite common, but completed suicide is still statistically quite rare. Elderly people over 80 have an increased risk of suicide. Middle-aged men are at increased risk of suicide, and we know that young Māori males are at increased risk of suicide.
Back in our tūpuna time, when a great chief died, and I'm thinking about this particular chief in the north, two of his wives committed suicide. They saw it as accompanying this great chief to the other side of the vale, so he wasn't lonely on his own. Hareke tua te arai, farewell, go to the other side of the vale. These days though, one needs to understand what it is to preserve life, that it is a sacred situation. We want to be able to fulfill our potential and to provide stability, because age for Māori also means being able to look back, ngā taonga tuku iho, which means to hand back down the treasures of our family to our grandchildren, to our children, so that when we pass on, they hold all those gifts that I knew about that they can provide to the rest of their families.
Once someone has attempted suicide, the idea is out of their system.
Somebody who's attempted suicide is actually at increased risk of going on to complete suicide. If somebody has made a suicide attempt, then it's really important to provide them with the assistance and the help that they need so that they can cope the next time a crisis comes up.
Sudden improvement after a suicidal crisis means the risk is over.
If somebody has been talking about suicide a lot and is very intent on taking their own life, and then they're suddenly very happy, that's a warning sign that we ask people to take a lot of notice of. For example, if somebody has just gone onto a course of antidepressants, there is a period of time where they may feel considerably better and have the energy and the planning ability to go through with a suicide attempt.
There should be more public awareness suicide campaigns.
The idea that we should have big public campaigns about suicide and suicide prevention comes up a lot. If we're talking about suicide in a big group of people, for example, a school assembly, the person who is speaking about suicide has no way of knowing the level of risk that is present in that group. The best way that we think people should talk about suicide is at a one-to-one level where one person can help the other person or take them to help.
Only trained professionals can prevent suicide.
We all have a role to play in suicide prevention. All of us are in a position to notice behaviour changes or somebody who's struggling, or reach out to somebody who may be experiencing difficulties. And those are primary opportunities to prevent suicide.
If you'd like more information about suicide prevention, visit SPINS online at www.spins.org.nz. Ka kite.